I have a question for Dr. Van Kerkhove. I saw that she wrote an op-ed, calling on governments not to forget that COVID-19 happened. And I wanted to ask her if she could elaborate a bit of why she felt the need to write that op-ed and kind of like what would she like to see governments do. I know she made the point of the, pandemic treaty negotiations or pandemic agreement negotiations, but I was wondering if beyond that, there's some other things that Dr. Van Kerkhove and the WHO would like to see governments do to be better prepared for future pandemics. Thank you.
Thank you, and over to you, Dr. Van Kerkhove.
Thanks very much. So we get the question a lot of, are we ready for the next pandemic? And the Director General answered that at the last press conference with a yes and a no. And a lot of what we do in support of member states is preventing, preparing, getting ready for, to mitigate any outbreaks to prevent them from becoming epidemics and pandemics. And the world right now, largely, many people want to pretend COVID didn't happen. And I think there are many reasons for that. The last 5 years have been incredibly traumatic. We've lost at least 7 million people, but we estimate that that number of deaths is much, much higher. Everyone has been impacted by this. And what we've learned after each outbreak, after each epidemic, after each pandemic, is that that trauma that we've gone through, the investments that we've made across the spectrum of surveillance, of infection prevention control, of emergency operations, of supply chain management, of clinical management, the whole spectrum, those investments that were made through blood, sweat, and tears are investments for the current threat that we face. And let's be clear, COVID is not gone, but also helps us to use them for known threats, like we've talked about with Marburg, for example, of avian influenza, of dengue, of plague, you name it, but also the next novel threat that we face. And the reason for that op-ed was to encourage governments to continue to invest in the health systems, to continue to invest in the workforce, in people, for early detection, for transparency in reporting, and what we have put forth to be able to be better prepared. There's a lot of investments that have been made in the workforce. There are investments that have been made looking at tech transfer, looking at mRNA hubs, looking at different hubs for supply chain or for intelligence, looking at data and better use of data. We want to see those investments sustained. And it's a difficult challenge right now because governments are facing very difficult choices because of all the other complex emergencies that are happening that the DG also mentioned, war, displacement, climate effects, and so on. And so we don't want to lose sight of the infectious threats that we are currently facing. And right now in the Northern Hemisphere, for example, there's a huge burden on healthcare systems from influenza, from COVID, from RSV, from human metapneumovirus, from mycoplasma pneumonia. And we just have to make sure we just don't lose sight of that. So that was the purpose of the op-ed, and to remind everyone that while we are dealing with emergencies, like you've just heard Dr. Mike Ryan talk about sitting in Afghanistan and the work that we do in Gaza, that we have to not lose sight of those infectious threats that we face.